a look into Medicaid and Medicare by Tina Coghill and Samantha Walther. What is Medicaid? Medicaid is an insurance program that assists low-income families to help pay for healthcare needs. Medicaid is funded by the government but is controlled by the state that an individual lives in. Each state may have some different requirements, but most of the states require for monthly income to be below a set level determined by the state and for the person's savings and resources to be under a certain value. It also requires a patient to be a legal permanent resident. So this is good for people who have low income or are disabled, but it is exceptionally a great option for people who are pregnant or people who have children with the low income. So what is Medicare? Medicare is made for people who are over the age of 65, for younger people who have disabilities, and people that are on dialysis, so people that have end-stage renal disease and are on permanent dialysis or are requiring a transplant. There are different coverage options that cover different topics. There's part A, B, and D, which we will get into a little bit later. This is a great option for people who are of the retirement age and wanting to retire, and again for those people who have certain disabilities. So what are benefits of Medicaid? Low-income families are able to get the health care that they need at little to no cost. There are 25 different eligibility categories. They have a broad range of services that they address for the population that they serve. They also have a long list of mandatory benefits as well as optional benefits such as dental and vision. You can find out eligibility for Medicaid by calling your state health insurance assistant program, and they can help you apply as well. If you also go online to the Medicaid website, they can help you apply as well as help you find out your eligibility. So what are the benefits of Medicare? Most plans have no cost and usually have a prescription drug coverage. They also provide many preventative and screening services. So Medicare will provide screenings for cancers, alcohol misuse, and screenings for diabetes. Medicare also does provide many of vaccines and shots, just like they would provide a yearly flu shot. So what does Medicaid cost? There is no monthly cost for families to be on Medicaid. However, the cost for out-of-pocket things such as copays, deductibles, and coinsurance coverage could be higher. The maximum out-of-pocket costs are limited, and there are typically none for pregnant women and children. What does Medicare cost? The cost will depend on your annual income. So it could range from $135 to $270 a month, and that also is going to depend on what parts and how many parts you get. There is also no limit of what the monthly cost may be, but there is a limit of out-of-pocket costs. So when it comes to the deductibles and copays, that's where you could probably save when choosing this option. So what are the different plans when it comes to Medicaid? There aren't really any different plans to choose from with Medicaid. There are two different categories, the BHP, which is the basic healthcare plan, and then there's the CHIP, which stands for Children's Health Insurance Program. So the two options are really kind of for adults and then for children. Next, what different plans are there of Medicare? There are three main plans of Medicare. There's Plan A, which will cover inpatient and hospital stays. And then there's Plan B, which covers outpatient care, such as outpatient therapy and things of that matter. And then there is Plan D, that covers prescription medications. There is also a Part C, which is also called the Medicare Advantage Plan, where private insurers are funded federally by Medicare to provide services under Part A and Part B.